Hey, everybody, welcome to this week's episode of Making Sense of It All. So, my guest this week is Tim Marten. He is the founder of Lift Physical Therapy. Tim, thank you so much for joining me.
Hey, thanks a lot for having me on the show. I really appreciate it.
So, high level, before we get started, I ask everybody this, but tell my audience what you do and what you do for your clients.
Okay, so I'm a physical therapist. I own my own business and I work with my clients and patients in their homes. So instead of them going out to a clinic, I go to their house and I can bill their insurance as if they're in a clinic also.
That's fantastic. Concierge-based medicine.
Yeah, basically it's concierge physical therapy. Yeah.
That's fantastic. Tell me what it is. What was it that inspired you to get started? How did you get into physical therapy? And then kind of, the second part of that is what made you decide that kind of taking that concierge approach was the right thing for you and your business?
Yeah, I mean that's a good question. In high school, I don't have a super interesting answer for why I got into PT, but in high school, I took a career placement test and it was like 98% physical therapist,
All right.
and I'd never even heard of such a thing actually back then. But I was really interested in weightlifting and science, and I was thinking about going into healthcare. And then when I actually shadowed a few physical therapists and I thought it was a pretty good fit. I just stuck with it and must have been almost 8 years later. And then I became a physical therapist after doing all the schooling.
Nice.
So yeah, it took a while, but it was definitely worth it. And it is a good fit still to this day. The reason I got into kind of what I'm doing right now is a couple reasons. And one is when I got out of school, of course, I needed to start working, and I worked in a few different companies per diem because it got a little more pay that way. You got paid by the hour, and then also I
Sure.
got to experience different settings. And so one of the settings was home health. So your traditional home health, you'll go to someone's house. Usually they're really low level, like struggling to function. They usually can't even really leave their house. They're what's called homebound.
Right.
And so these patients really need therapy in their home because they can't even go out to a clinic. And so I saw the benefits of that. Also, you got to do one-on-one therapy because you're obviously going to someone's home. They're the only patient in there. So I saw the benefits of giving one-on-one therapy, meaning one therapist to one patient.
Sure.
But of course, then I saw the benefits of home health. I also saw kind of the not so great parts. And with your traditional home health physical therapy, you get paid a flat rate for the patient, and the PTs are kind of incentivized to see as many patients as possible. So they're rushing to go, and usually their schedules are overbooked too. They're rushing to go to all these people's houses, and they kind of do the bare minimum just to get from one to the other, and they have to document so much that the patient ends up getting kind of bad treatment,
Okay.
and the therapist ends up getting overworked. The company makes money, and insurance companies make money also with that whole system. I'm not really trying to bash it too much, but I knew it could just be done better where it's better for me, the clinician. It's also better for the patient that they get better care. So that's why I started doing what I'm doing right now.
Yeah, there's an opportunity for it. I mean, I don't think it's bashing anybody to say, hey, I think something can be done differently and better.
Right. Yeah. So that was the goal. And I've done a little bit of that already. And of course, the patients like it, and I like it too. So I think there is a good little niche there for it.
No doubt. I think, it's funny because when physical therapy, comes to mind for me, a lot of the times I think, sports injury, or I think, an injury of some sort. And then I have to go, basically to a clinic or something to where it's physical therapy to rehabilitate an injury. But I think that's a very short-sighted view of what you do as a physical therapist and what you could potentially do for somebody. Yes?
Yeah, you're definitely right. I mean, physical therapy in most cases, I think, is for that. It's for rehabilitation if you were injured. It's for specifically like maybe a sports injury, something like that. Um, One thing I'm trying to push more actually PTs can do a lot, so many different things. It's really, it's impressive. But one thing that I'm trying to push, it's going to take some time, is more prevention. And because,
Mm.
with our healthcare system, it's so reactive. It's set up to prescribe a medication for something that already happened. It's set up to rehab an injury that already happened.
Right.
And so, and it makes sense. Maybe that's human nature. We wait till something is a problem. That's how you solve a problem. You have to identify a problem. Usually we wait till it becomes a problem and then we come up with the solution. So something that I'd like to see in the future is if you kind of think of the model for a dentist. When was the last time you saw your dentist?
You asking me? It's probably about
I'm
two,
asking
three
you.
months
Yeah.
ago. 2, 3 months ago.
3 months ago. Yeah, of course. So like most people see their dentist either every 6 months or once a year.
Sure.
And I think it would be really great if people saw a physical therapist once a year, just because they may be able to screen you and find an area that's more likely to be injured than other parts of your body. And again, you won't really know if you're really tight or really weak in a certain area unless someone kind of shows you. So it'd be kind of like a dentist where, once a year you see your PT, they go through this full body screening. They show you, hey, you're really weak here. Do these exercises. And I think it would actually prevent a lot of injuries in the long run. Of course, you could always see them if you have a problem, but just that prevention screening, I think would be a really big impact.
I don't disagree. I think that there's like it's funny because I think sometimes people get hung up on the word therapy because most of the time, any kind of a therapy, whether it's physical therapy or if it's mental therapy or any kind of a therapy, is typically following some sort of trauma. So I think that the word itself almost it trains you to be reactionary to something rather than be preventative to something.
Yeah, and you're absolutely right. And even some people think because of the word therapy, they might even have like a stigma or, already have an idea about therapy. Some people think because it's physical therapy, they think, oh, I'm weak if I go to physical therapy, or I don't need physical therapy because I'm not old. I don't need physical therapy because I'm not injured.
100%.
Yeah, but I mean, we're talking about your every joint and muscle in your body. We're talking about really like your entire body. And so most people could benefit from targeted exercises or physical therapy, especially with our society, how much more sedentary we are than we were a few hundred years ago or even a few decades ago. Just we do a lot of sitting. You see a lot of the same issues, a lot of tightness in certain areas, a lot of weakness in certain areas. And so physical therapy could be a really great way to reverse some of these problems for a lot of people.
I agree with you 100%. And I think that there is such a groundswell or a movement right now. I think that people are looking to make themselves healthier, whether it's the food that they're ingesting, how they're physically treating their bodies. All of these things, I think it's a tremendous opportunity for you right now to definitely to tag into that. It's interesting. I mean, this may not even be something that you address, but it's something that came up with me, not that like within the last day. Somebody had introduced a Zoomer peptide test to me, talking about basically identifying what kinds of foods your body responds to well, what kind it responds to poorly. And it's the same kind of a thing you're talking about, where it's not necessarily trying to be reactionary. It's trying to be proactive and say, hey, this is what you should be eating in order to have your healthiest body. And I think that from, just same way along those lines, people should be looking at it saying, what types of physical activity, what are the things that I should be doing for myself to give myself the opportunity to be my best?
Yeah, I think there is more of a push for those kinds of treatments, like, doing I'm not exactly what you did, the peptide. What was it again? Could you say it again?
Yeah, it's a Zoomer peptide test, and it's essentially it identifies what types of foods and beverages and everything that like how your body will respond to them. It's a hair test essentially, to where they
Oh, okay.
and it's and it was actually introduced to me through a golfer actually, but essentially talking about essentially, like if you are like more sensitive as far as from an inflammatory response or different types of responses that you can have to different foods, it was basically talking about, your essentially your physical therapy, but internal, talking about like what should you be consuming
Right.
to make sure that you are at your, can be at your potential peak or your optimum health
Exactly.
from a
Yeah.
food
So there,
nutrition standpoint.
yes. So people want to always want more, always want to be better. They want to optimize. And so that would be a great example for your nutrition. That's something physical therapies could really do for people. They could, it'd be a lot similar. It'd be a screening that tests you, exactly you, where your weaknesses are, where you're tight, what areas you need to work on, and then push you in the right direction. The rest is kind of up to you. Are you going to follow the plan or not? But it can help you optimize your body, the way you move, which could affect so many different things. I mean, I was looking up a stat the other day. I dug a little deeper because it surprised me. So, the number one cause of death in America is heart disease. Most people know
Hmm.
that. The number two cause is cancer, and a lot of people are aware of that as well. Number three is disputed, but it's usually lower respiratory infections. And I always knew that heart disease was number one, and that exercise can help prevent heart disease. I always knew that, and I thought that was impactful. But I actually looked through all of the top 10 causes of death, all of them, all 10. Exercise can help prevent every single one. It's not necessarily going to cure it, make it impossible, but it can help prevent all 10 of the top 10 causes of death. I thought that was so powerful that, I mean, there's got to be a way to get more people to exercise, especially in a way that's more beneficial or optimized, like you said, where you essentially be saving people's lives, preventing their risk of death. It's just, there's a lot of opportunity out there.
No doubt. Well, and I'll throw it to you since you're the expert on this. How do you get people to get off their butts and do more
Yeah,
exercise?
that is such a great question. And I have my own approach. Everyone's got their own different approach, but I believe that you got to choose something that they enjoy doing. Like that's just human nature. If they like doing it, they're gonna do it. So I try to find something that the person likes to do that doesn't hurt, that's not too hard. I'm not gonna expect them to do a perfect, rigorous exercise routine, every day at 5 in the morning, moving forward. You got to be realistic. So the best way to get someone to really make a change is, if you could have them join something with a friend, or even better, a group. They're more
Hmm.
likely to keep going because they get other benefits out of it. It's not just the exercise, and it's not just something they enjoy. It's also like a sense of community. And so they're just more likely to stick to the plan, especially if they've got someone motivating them and they kind of feel like that other person or that group even relies on them. So if I can find something they enjoy, they know someone nearby that kind of has the same goals. Maybe it's just playing pickleball. Maybe it's playing golf. Maybe it's going for a walk. I start small. I'd rather them do a little bit and a lasting change, and then we can move from there.
Very good. So aside from, say, doctors referring people into physical therapy, how are you getting in touch with people? How are you bringing people into your program and introducing what you do?
Yeah, that's a good question. I mean, I'm always looking for new ways to not just build my business, but just to help people stay healthy. So, I've done as many things as I can do. Of course, I'm advertising. I'm doing something like this, like a podcast. I've talked to local sports teams. Um, there's a pickleball league here and where I live in my community, so I'm speaking to them. The tennis players, the golfers. There's a high school weightlifting team that I'm partnering with, and it kind of brings it back to that whole community thing. Um, if I'm local, it makes it easier for me to obviously connect with these people, and then treat them, or I can drive to them and go to their house a lot easier.
Sure.
So just and I feel, everyone brings up, it's hard to not bring up COVID whenever you talk about anything at all. But of course,
No,
COVID,
it changed things dramatically. Like it
it
changed our
did.
approach to things.
Yeah,
It forced people to get creative.
it absolutely did. So pre-COVID, uh, I would think people were a little more, I mean, during COVID, everyone went inside and, get away from me, basically. Stay away from people, stay inside. Social media has been trending up already, but during COVID, it kind of exploded. So it just seems like there's more a sense of people connecting online and not in person. And I think during these last few years, so many people want to connect in person with their community, with people face to face, like they're almost craving it.
Right.
And so if I can get out there and connect with people in that way, in any way, and whether it's going to a team, whether it's doing a workshop, whether it's with a group, whatever, any way I can actually connect with my community, people really appreciate it and they just get more value out of it. So
I
those are kind
agree.
of the ways that I've been really pushing it.
That's fantastic. Not to put you on the spot, but do you have any success stories, people that you feel like really, really crystallize this for our audience? Like talk, like something that really shows the possibility of what's possible when you look at physical therapy and how it can better their lives.
Yeah, there's a bunch of success stories I have. I don't like to take full credit because, in my opinion, I put the power in the patient. So it's really up to them to do the work. I just guide them and help them along the way. But I do think of one patient I had when I met him, he was in a wheelchair and he was so determined to get out of that wheelchair. I worked with him for a year. I went to his house. We started in the house. He could barely stand up from the wheelchair.
Mm-hmm.
I used the kitchen sink to help him to stand up. And we strengthened him over time. Eventually we could barely walk in the kitchen. Then we were walking around the house. Then we were walking around the neighborhood, using a walker. And then we got him to his community gym. And it just build and build and build. Now he's at the point where he's walking laps around the neighborhood by himself without a walker and going to the gym, doing his own exercises on his own. That's the biggest change I've ever seen. Well, he was in a wheelchair, but really
Right.
it's not because I'm magic. It's because he had that drive and he had the willpower to do it and to work hard and that's how you got the success.
Yeah. What is that old saying? Find a willing student and the teacher will appear.
I've heard that maybe once. I'm glad you said you're full of those. I gotta say,
I
you got good.
might have butchered it, so don't.
No, but yeah, I mean, where there's a will, there's a way. Of course, like yeah, he just needed somebody, and I just happened to be there, and it worked. And so physical therapy definitely works, but the true power is in the patient.
No doubt. Tell me a little bit about really the home-based approach, because I think that does set you apart. That makes you different than a lot of people that are physical therapists out there. What are the values and benefits of being able to go to somebody's home and treat them where they live?
So there are a lot of benefits. The obvious one is it's just convenient. So that could be convenient whether you just don't have the time, whether you can't fit in a 9 to 5, go to a clinic somewhere, you've got a really busy schedule, and maybe you work from home and someone can come to you and they can work with you on a break. Maybe you work somewhere else and they come to you after hours. Like I could come to you after hours, work with you then. Another benefit is when you're in someone's home, it's just you and that patient or whoever else is in the house. You don't have other patients in other rooms. You don't have an assistant that's going to walk in the door and say, "Oh, I need you to do this really quick." There's no interruptions. There's really no distractions. So I walk in someone's house. I'm 100% focused on them. There's nothing else that exists but them and their house. Another benefit is some people just struggle to get out of the house. Like I was talking about earlier, when you have a traditional home health agency, these patients, maybe they can't even possibly get out of their home, or maybe it's just so hard for them to get out of their home. So if I go to them, I mean, you almost think of like the traditional doctor used to visit people when they were sick and at home, they would go to their bed and treat them there because they were just so sick they couldn't go to the doctor. So
Sure.
it's kind of similar to that. It's very convenient for the patient.
No, I agree. I mean, the things that I just thought of while you were saying that, I mean, it's flexible, private, and it's one-on-one attention where you're meeting them where they are. Like it's fantastic. I think I mean, especially when you're talking about somebody who's who isn't necessarily in the best physical health. They may have some self-consciousness about themselves or about where they're at with their physical mobility or their physical ability. So I think when you can meet them where they are comfortable from a psychological perspective, they are already comfortable, trying something new, trying something different. Whereas if you put them into an uncomfortable setting, they probably crawl inside themselves and they're not going to be comfortable trying something different.
Yeah, that's another good point that I didn't mention. That's very true. Some people have what's called the white coat syndrome, where you take their vitals or their blood pressure when they're in the doctor's office with the doctor, it's super high. I go into people's homes and they're just more comfortable. And
100%.
comfortable doing it, and they're comfortable talking to me. And then when you're comfortable with someone, you're more likely to open up about problems you have and just be more open-minded in general. So it definitely works out for this setting. For physical therapy, I think it's very beneficial.
I couldn't agree more. I think it's fantastic. If people are interested in working on their bodies, and if they're trying to, they don't really know where to begin. Like, what do you recommend? What's the best way for them to get started?
So it's a really good question. It's tough to answer because I want to push people to the internet, but it's just so full, it's jungle. There's good advice, there's bad advice. But it depends on the person. So if you're a very independent driven person, there is just so much great information on the internet. I would push a website called Physiopedia, which helps you kind of look up kind of your own problems and then kind of points you in the right direction.
Mm-hmm.
There's a lot of good information on YouTube. There's also bad information. So it's hard to discern the difference. If you're motivated and pretty intelligent, it's not a bad place to start. But of course, the best way would be to see any physical therapist that you trust. So the physical therapists are considered, they like to call themselves movement experts. And for the most part, they are. So if your problem is movement related, you're best off seeing a physical therapist who works in kind of the setting that you need. So if you're an athlete, go see a sports physical therapist. PTs often specialize in certain areas. So you can't go wrong by seeing one. And actually, you're better off, not to kind of toot my own horn, but to see any PT who's off on his own or her own. They don't have a stake in the game. They're not controlled by a company necessarily. You're more likely for them to give you more time and take their time on you. So if you could find someone, a PT that maybe your coworkers or friends could recommend, that'd be really the best place to start.
Well, I would say that that's the whole point of this right now is we are tooting your horn, Tim Marten. That's the whole goal with this. So I think that, raising your own banner and talking about what you do better than somebody else, there's no problem with that right now. I think it's fantastic. I love the way that you're set up to meet people where they're at. That you really are trying to bring the benefits and the advantages of a home-based system to your patients and to the people that are interested in your services. If people want to learn more about you, if they want to learn more about what your company Lift physical therapy, where's the best place for them to find you and get in touch with you?
So they can go on liftphysicaltherapy.com. They'll have some information about me and the services I provide. If they want to get in touch with me, email's the best. So it would just be tim@liftphysicaltherapy.com. I'd be happy to answer any emails.
I think it's fantastic. Tim, I want to thank you very much for joining me today. I think the audience got a lot out of this conversation. And if you're interested, if you'd like to even just have a conversation with Tim and figure out if physical therapy is right for you, I'll make sure that the information that he just provided us is also underneath this. So, Tim, thanks again for joining us.
Thank you a lot, Jesse. Appreciate it.